Hi, Zoila.
Hi, good morning.
Um, if an application asks for, is there anything you would like to add? Or here's a box for, I guess they want you to add something. There's sometimes a question that come up is, why are you interested in this role?
Okay.
That's a separate, like that's like a requirement usually for a lot of these community organizations that want you to hopefully speak about the mission. But then there's some applications that ask for, is there any additional information you want to add? What would you suggest for those? Because it's already been, should already be addressed
Should
in the summary.
always be resume cover letter, resume cover letter, resume cover letter.
Well, yeah, if those have already been attached, like the cover letter is already in there, the summary is already in there, and then the some part in the application that says, is there anything else you want to add?
No,
Or
no.
okay, do you just skip the question then? Okay.
Yeah. As long as you're covered. Usually I see that when they want the cover, like usually I see that when they give you a space for the resume and then they say anything else you want to add. Usually I see that to be for the cover letter. So
Okay.
that's what I'm, but if you're saying, well, they had two spaces and then they said anything else to add, sometimes that is a writing sample where the job would have asked you, please submit a writing sample. But if they did not ask for it, do not submit.
Okay.
Yeah, yeah. Good question. The other Cynthia, we have two Cynthias. So Cynthia, you are your hands up again.
Uh, Hi, Zoila. Thank you again for letting me ask
Yeah.
further questions. For county, state, and city public health jobs, it very much sort of mirrors federal jobs where they're asking you questions, skill-based, specific experience-based questions. Um, I realize maybe this is a more nuanced question. Would you consider maybe holding a workshop on how, like length of those questions? Should we be directly pulling from resumes? Could you consider maybe doing a workshop on that? I
Cynthia, you're
don't
in my head. You're in my head. Yes,
You're
yes, yes,
always in
yes.
my head. Thank
I'm
you
just,
so much
yes,
for
yes. No, I want to. I want to. I want to. I want to. But the problem, not the problem, but like HPS 1, AGPA for state level in California seems to be a big request. Because I'm in California, I tend to get pulled a lot for California, but I also want to figure out a way to, see how I can. Obviously, I've helped people with New York, Florida, Georgia. Like but I feel like there's certain states that are more rigorous or more nuanced, and just the paper trail is more confusing. So, but to your question, if you're running into city, county, state where there are like the best way to quickly assess if you qualify is to find their supplemental questions, which is pretty common. So you have to find additional questions, supplemental questions. There's usually something where they want you to make sure you're really good at before you submit. And that is what you use in your summary and in your cover letter. So not only does the job announcement and the qualifications will allude to the things they want you to really hit on, but the questions, the supplemental as well, will point you to their highest sort of qualifications and desires. And what happens is when my mentees and I do the assessment of the qualifications and then we look at the questions as well, their supplemental questions, we're able to formulate the summary, right, with the bulleted resume, but also the cover letter. And then usually we're able to copy and paste the responses from the cover letter into the supplemental questions because it was properly raised and addressed, and we know this is what you're looking for. So just and then I know there's exams. Not city isn't really into exams. County maybe. It again depends on what state are you in, Cynthia? Are you in California?
Illinois, but I know California. I've sat in on California Department of Health, what there.
Halls. Yeah.
I know
Okay.
they have exams, assessments.
Yeah, yeah. And so then some states have exams. And then there's certain ways to get into those exams. Like for example, New York, there's only 2 days a year you have to sit in for. In California, they're kind of open. And the way that I get people into the state of California is I tell you to apply to the job that you see, and you can also do your exam continuously. There's two things you could be doing at the same time. but you don't have to pass the exam in order to get invited to the interview. It's okay to actually submit for the application itself without having your exam screened. Because what happens is if and when you get pulled in for an interview from the thing you applied to, the job you applied to, that manager that may want to give you an offer is going to advocate for you internally and push your paperwork so that your exam is that it basically reviewed and scored. So there are these like little like sort of tricks of the trade that I can kind of keep sharing as much as I can. And if you want to DM me or ping me, I'm happy to entertain whatever's going on with, say you find something. But yes, this is part of my vision of Public Health Hire 2.0, where I am now able to dive deeper into some of the more specific challenges we face when it comes to certain sectors and government exams or how to submit properly and all of that. It's been on my mind, but getting organized around it and to what extent and all of that, I'm still kind of mulling over. But yeah, if anything, I may just call like a special session and kind of show you guys how people have been getting through because I do have some winning like applications from that, including my own. So yeah, more to come on that, but it's something I want to do. It's something I want to do. Let's just put it that way. Yes, it's something I want to do. It's it is something I want to do, but it's getting to it and it's almost like I love this time that I get to, hear more from you guys on what you really need because obviously I want to meet the need, but I also am trying to manage the time and manage the expectation and I am also growing partnerships. Companies are wanting to work with me, so it's like it's kind of juggling all of that. Good problems, good problems. I'm not complaining. I'm trying to be a little transparent of positioning myself with my time. And then summer, of course, is just juggling the children. But yes, Cynthia, more to come, more to come. Questions? Anyone want to give update on how it's going? Anyone getting, callbacks or even rejections? Unfortunately, rejection notifications is a good sign. I know it hurts, but the fact that you're getting screened and you're not getting ghosted is a big deal. Because it's very easy for these companies just not to get like or they just don't review you for like 3 months, right? So if you're getting rejection emails, at least you can just know that's moving on, moving on, moving on. Like in its own way, it is positive. As hurtful as a rejection is, I know it's a bittersweet feeling. Hi, Sylvia. Yes, you have another question?
Yes, thank you so much. Excuse me. Thank you so much. So my question is, I feel like I need to improve the answering skill for behavioral question. So for those questions, would you please help me to like get any resources or any tips that would be really helpful
What do
for
you
me?
mean? Okay, hold on. What do you mean by behavior questions? Because I define them a little differently than what you may have been hearing. I define them as detail oriented, broad, or maturity. So when you say behavior question, give me an example.
Like how do you handle stress or um, if you have any conflict with your colleague at the workplace, so how do you handle? So
Conflict.
those type of
Conflict.
questions.
Yeah,
Yeah, yeah.
conflict management. That's maturity. That's maturity. So to here, I try to kind of break it down on they're looking for self-awareness. They're looking for maturity. They're looking for someone who's not going to throw another person under the bus. So um, just so that you understand, anytime you're thrown a conflict question, like what would you do if say you needed something turned in and the nurse that was responsible for it didn't complete it on time, right? Just as an example. These questions, all of my training is meant to help you lift and reminisce on past experiences. And the problem with this one is that everyone on here will say, well, I've never had a problem with a colleague. I don't have conflict. I just do my job. Everybody's always happy. And we know that's not necessarily true, but you're just not sure how to approach this. So the problem with these scenario questions is that the real test is share how you've handled conflict in other places. So that is where you still have to anchor yourself on your own experience. And you want to be able to frame the context, right? So in other words, if I was just to jump off this simple example of a nurse not turning in her information that we needed for a report, you would say something like, you know, I totally understand when people are moving really fast, there's multiple priorities, people are burnt out. And in my past experiences, I have been in different environments where it's fast paced and we're trying to meet multiple deadlines. And I have, from my past experience, supported my managers in meeting those deadlines and making sure that reports are done on time. And whoever needed to complete information, they were given sufficient time before the actual deadline. So from my own experience, this is how I do it, right? This is how I handle deadlines and working with other people and making sure that, if that person called out sick, maybe obviously, that's not their fault. But if something just literally dropped, then in the past, I will go and do what I can to find the information or talk to their supervisor if they knew about this project and if there's a way for us to reconcile the data, right? Or if there's a way to work with leadership to push the deadline even further. And then I would make sure to talk with this nurse when I see her and just ask how they handle this usually. Is there a better way for us to work together? Want to make sure we close the loop and follow up and just make sure that they have everything they need to complete their task. That's how I would do it.
Thank you.
You see, it's not about feeding into theory. Don't feed into their assumptions and theories and what if and what if, what if. That's where you guys fall flat on your face. And what I find with my mentees is that it's usually about you against a person, and you have to stop that. It's not about you and the person. It's about the context, the work, your past experience, similarities. And then that's how you come with your response. Now, it's not easy. I'm not saying it's easy because in fact, my mentee who just went through 3 rounds, this is the one that terrified her because she falls into theory. Her trap is just theory, theory, theory. I asked her, what does access to care mean to you? And she just talked for 5 minutes about theory. And I'm like, you didn't tell me anything about your background on how you've seen access to care and disparities and, translation services and scaling programs and mobile clinics. Like, you didn't talk anything about your own experience of how you've seen access to care, be improved, in your own work. So even if it's questions about like, what does advocacy mean to you? What does access to care mean to you? What does health equity mean to you? All of those are maturity based. That's self-awareness. Do you understand that we simply want to know how have you experienced these things in your work? That's the underlying question. Right? So it's always about the work. It's about the work. It's about the work. All right. So I'll stop there. I have 2 hands and then we'll stop. So Angelique, I think you had your hand up first and then Parama.
Hey, yes, I have just a quick question to kind of just soft parlaying applications, and I am getting no's, and I know I need to tweak the resume. What is your opinion of once I meet with you and we redo like the summary in my resume? If those jobs are still listed, should I go back and re-upload my resume?
If you
Or
can.
is this a walkaway? Some of them are allowing, like, is it Deloitte? I think I'm saying that right. I want to say Deloitte, but that's my little French.
Deloitte.
Deloitte. I keep saying it, me and my little old French self. Like for instance, I applied to them for it's a health manager, a health analyst position. And I know it's not tweaked the way it needs to be, but it does say to go back and re-up, to go back, leave it open, update resume as needed. And it's been posted for like 20 days, and they have like 9 of them.
Do you have a summary at all? Do you have a summary at all?
No, I'm still working on that. So you
Yeah.
think I should not apply to nothing until I get that down?
You're wasting your time.
Wasting my time. Okay, very good then. That's good to
Wasting
know.
your time. So
Okay.
try to get into Masterclass 102 and jump into the summary as much as you can. You don't have this, it's not easy. It's not easy. This is not easy. So I don't want you to feel like
Right.
you have to understand all of it, but I want you at least to get your feet wet so that when we meet, your sense making is right.
Good to
Like
go.
it's a go. Yeah, it's like, okay, this is this, this is that, this is that. And then once you have that template, that's when you can really like
Blow it out the water.
see and
Gotcha.
blow it and run. Yeah, yeah, yeah.
Okay,
I
all
think
right.
right now
I'll
you're
hold
just
back then. I'll
wasting.
just keep just
Yeah.
kind of bookmarking some of them. But and I knew it because immediately this morning I woke up, I had to know. And I go, you know what? I
Like,
knew it, but I was gonna
why
do
am
a
I
little Hail
getting all
Mary.
these
You never know.
rejections?
You know what? A little Hail Mary. I'm toughening up my skin. So I definitely wanted to get your opinion on that. As long as the some of these the talent searches allow you to go back and re-up, then I'm going to
If
make
it
sure.
lets you, I mean, if it lets you, yeah, I don't know how they're screening them. So if it says just to upload, um, absolutely. Yeah, no, the summary is a deal. It's honestly, I don't know anyone getting hired without one. Like I don't.
Okay. All right. So then I need to again, I'm an older seasoned woman, so I got to rethink how this process is
And it's
happening.
not, and it's okay. It's not an objective. Some of you think it's an objective where it's like, oh, seasoned nurse looking to be
Yeah.
a public health professional. No, nope, nope, nope,
Mm-mm.
nope, nope. So just
Okay. Thank you
try
for
the
that.
summary and then, yeah, and let's meet sooner than later. If you
For
don't see
sure.
availability, ping me and I'll,
Too.
yeah,
Thank you.
you're welcome.
Perfect. Thanks.
You're welcome. Parama, last question, and then I'm gonna log off. Go ahead.
Yeah, so I recently had an interview on a Thursday, and then I thought the interview went well. I was qualified. They wanted someone with MPH and like government experience, which I previously worked for the state of New Jersey Health Department. And then on Friday, I think it was like 24 hours later, I got a rejection email. So I was just not, I was kind of shocked because she told me that like by Monday I would hear back, but I thought I did well in the interview, so I wasn't sure like what happened and how like that I got a email so quickly.
Okay. Um, was the quickness isn't my concern. I think I just want you to feel like you learned something from all interviews are practice, right? So all interviews are
Hmm.
practice. So is there something that you felt, was there a question that threw you off, or did you feel like all the questions you were prepared for? Let's start there. Did you feel prepared for all?
Yeah, I felt prepared for all. There was a question about like annual strategic reporting, which I she asked if I like led that. I said I was like part of a team that did that, but everything else I think I answered well.
And the one around that one, did you give context though? Your contribution,
Yes.
you did all of that. Okay.
Hmm.
And did you have questions for them?
Yes, because they
What were your questions
basically
for them?
um basically they had a program and I was familiar with that program because they worked with the state government. So I just asked like additional follow-up questions about that program and like my experience with that program. Yeah.
Wait, I don't understand. So what did you ask them?
Um,
What did you ask them when they said, "Do you have questions for us?"
I asked what opportunities were there for growth and professional development
Was
with their company. And
was that
then
was that your first question?
no, my other questions was like what steps were they being done to increase like program participation because I mentioned like I wasn't aware of this program when I was working in the government as an employee.
Hmm. I think you introduced doubt.
Okay.
I think you may have introduced doubt into their mind. Because here's the thing, so I don't know exactly what happened in the interview, right? And I'm not
Hmm.
going to say it was this, it was that. But my inclination is that while you may have been prepared for their questions, which is fine, your first question has to be about the work. And I think maybe like you did talk, you said like, what's your strategies for engagement? Is that what
Mm-hmm.
it was? Okay. But then the question around the professional, I actually don't, I tell people don't ask that any, like, don't ask.
Okay.
Um, Instead, the better question is ask the interviewer, how long have you, what do you like most about your job and how has the
Okay.
company supported your growth?
Okay.
Because you're interested in them. You want like somehow we may be great in the questions, but then when it's our turn to ask them questions, it sounds like me. And
Mm-hmm.
it needs to not be that. It still needs to be about like the work, the some I understand we want to know if there's professional growth.
Right.
It is a turn off for a manager to hear that because no one's giving you a job right now. Like we don't really. So it's just from my experience, it doesn't really help anyone.
Okay.
I'm not saying that's exactly what it was, but if there was something to take away from that is maybe just be mindful of those questions you're throwing out. And then it could still just be sometimes you're not raising the right examples, like the strongest examples. I do have mentees who feel like, oh my God, I have the perfect example for this. And then they're talking and talking and talking, and 10 minutes down the line, they accidentally share something even better. And I'm like, why the
Mm-hmm.
hell have you been talking about this other example? Where's this? Well, wait a minute. So I want you to give yourself a little grace that maybe it's like, could I have raised better examples? Was there a stronger one? That sometimes is it too. So
Okay.
I'll practice. I'll practice. Yeah. Yeah. Hey, you got
Okay.
to the
Thank
table.
you.
You're welcome. You got to the table. How long did it get to like, have you been interviewing or has this been one
So I
while?
recently got laid off from the state health department end of June, so I'm still like
Oh,
in the
okay. I'm
process of
sorry.
searching. Yeah.
Like last week.
Yeah.
Yeah, like 2 weeks ago. Yeah, I'm sorry. Yeah, I've been getting a lot of contacts from folks who recently are hit. Like it's happening, June
Mm-hmm.
30th hit and people are being let go. So, but you're doing great. If you're already interviewing week 1 week out, you'll be fine. This was
Thank
practice.
you.
You're welcome. All right, everyone. Thank you so much for joining me today. Keep your head up. You guys can do this. Cheering you on. Okay. Have a good week. Bye, everyone.